Stopping Mounjaro or Zepbound can trigger rebound hunger before the scale moves. That hunger is not proof that your discipline vanished. The strongest protection is a plan built before your final injection. Structured meals, fewer foods you tend to overeat, regular activity, and early monitoring work better than waiting for cravings to become overwhelming. Weight regain gets harder to stop once small changes become routine. Mounjaro and Zepbound contain Tirzepatide, a medicine that strengthens two natural fullness signals from the gut. They also slow how quickly food leaves the stomach. When treatment stops, those effects gradually fade. You may feel hungrier, eat larger portions, and think about food more often without changing your routine. The medicine leaves the body gradually, so changes may not begin immediately. Some people feel little difference for weeks. Then dinner portions grow, evening snacks return, or cravings appear between meals. The scale may still look stable while hunger is already increasing. Reaching a goal weight does not permanently reset the body. A smaller body usually burns fewer calories than before. After weight loss, the body can increase hunger and make eating harder to control. Stopping treatment can raise hunger while your smaller body needs fewer calories, so the same diet may fail. If you plan to stop, start here. Begin recording 1 week before the final dose. Note meal times, protein sources, snacks, hunger before dinner, and eating after dinner. Record weight and waist size under similar conditions. This record provides a starting point before changes in hunger, eating habits, or weight begin. Next, simplify meals before hunger rises. Build each meal around protein, vegetables or fruit, and a measured serving of rice or potatoes. Protein and fiber usually fill you more than pastries, chips, sweet drinks, or creamy meals. The goal is fewer decisions, not perfect eating, when hunger becomes louder. Choose 2 breakfasts, 2 lunches, and 2 dinners. Keep the ingredients visible. Repetition lowers the chance that exhaustion leads to takeout, snacking, or a large evening meal. A food plan matters most when motivation is lowest. Calories from drinks need attention. Sweet coffee, juice, alcohol, and smoothies can add calories without making you eat much less later. After treatment ends, these drinks add calories while stronger hunger may make you eat more. A stable scale can hide extra calories. Your food environment shapes the outcome. Keeping tempting foods nearby forces you to resist them repeatedly. Removing them means fewer daily temptations. Seeing them less often reduces how much you rely on willpower. 2 people can stop at the same weight and have different outcomes. One skips lunch, keeps snack foods nearby, and depends on willpower at night. The other eats planned meals and limits easy access to foods they tend to overeat. Both may feel hungrier, but their access to tempting food differs. Clinical data confirm the broader risk. Adults first lost weight during 36 weeks of treatment. Even after that success, weight began rising again after treatment stopped. Those switched to placebo, an inactive injection, regained about 14% of body weight over the next year. That was far more than normal day-to-day weight fluctuation. Those who continued treatment lost another 5.5%, so their weight kept moving lower. Even with ongoing diet and activity support, the people who stopped treatment regained substantial weight. Those routines mattered, but they couldn't fully replace the medicine. Regaining weight was not a personal failure. Treatment had been helping with weight maintenance, and stopping removed that help. The practical goal is catching stronger hunger, larger portions, and more snacking before major weight regain. Use a simple hunger scale before meals. 0 means no hunger, while 10 means hunger so strong that controlling portions feels difficult. The exact score matters less than whether your usual hunger rating rises from 3 to 7 on repeated checks. Track the same time of day for comparison. Weigh every 1 or 2 weeks to see the trend without overreacting to short-term water weight. That interval reveals lasting change without reacting to normal daily shifts. Use similar clothing and timing, then add a monthly waist measurement. A single higher weight or waist reading proves little, but repeated increases across several checks deserve attention. Monitoring shows when the plan is slipping, and activity supports weight maintenance. Exercise should not become punishment for eating. Keep walking regularly and include strength training 2 or 3 times weekly. Strength work helps preserve muscle and supports daily activity. Regular workouts also create a routine that does not revolve around food. What matters most is the trend: stronger hunger, larger portions, and rising weight across several checks. One hungry evening after travel or poor sleep means little. Several weeks of larger portions, evening eating, stronger hunger, and weight gain suggest the plan is no longer enough. When portions and weight rise together, adjust the plan without delay. Poor sleep and stress can make hunger and cravings harder to manage. Short sleep can make high-calorie comfort foods harder to ignore. Stress can make you eat for relief rather than because you are hungry. Keep a regular bedtime and manage stress without turning to food, perhaps by taking a walk or shower. Stopping can affect more than appetite. If you use Mounjaro to control blood sugar, watch closely. Stopping also removes some of the medicine's blood sugar lowering effect. Stable weight does not prove that blood sugar stayed controlled. Your clinician may change how often you check blood sugar or adjust diabetes medicines. The reason for stopping changes the safest plan. Cost, side effects, pregnancy plans, shortages, and personal goals require different plans. Before surgery or another planned procedure, follow specific instructions instead of stopping automatically. Some interruptions are temporary. Others require a different long-term treatment. Whatever the reason, do not stretch injections farther apart on your own. If a lower dose is needed, your prescriber should select it rather than increase the time between injections. Your prescriber can decide whether to stop treatment, lower the dose, switch medicines, or continue treatment. Write the plan on a calendar before the last injection. Mark grocery days, meal preparation, weigh-in dates, and the follow-up appointment. A written schedule makes these steps harder to postpone. Before your final dose, decide which changes will trigger a call to your clinician. Call if weight rises for several weeks, you repeatedly feel unable to stop eating, or blood sugar worsens. Avoid reacting to one difficult weekend. Salt, travel, constipation, and hormonal changes can move weight quickly. Look for repeated eating changes and weight gain across several checks. The best plan catches a real upward trend early without overreacting to normal changes. A confirmed trend may require structured meals, dietitian support, or help when eating feels hard to control. A different medicine or continued treatment may be appropriate. For many people, obesity requires long-term care. Long-term medicine can support weight maintenance, just as medicine can control high blood pressure. The next step should match what is changing and why you stopped treatment. If you restart after a long gap, ask your prescriber which dose to use. The usual missed dose instructions may not apply after a long treatment break. Your restart dose may depend on how long you were off treatment and which side effects you had before. Do not use leftover pens to restart treatment on your own. Stopping Mounjaro or Zepbound changes hunger, eating behavior, and sometimes blood sugar control. Prepare before the final dose. Judge the trend rather than one difficult day. Respond early when hunger, portions, and weight rise together. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.